Hello, everyone. I hope you're all getting all the information, whatever you wish to get from this medical school application. And all the best for all the aspirants and also the equally hardworking parents in the group. Now, in this next three slides, I'm going to discuss on how to build this CAT known as UCAT. Um, it sometimes seems to be a very, very humongous, very, very difficult task. But having said that, since our team worked on this for past few years and we had finished one full batch on it, we also got very big experience on this, on what is the lacunae, what is the most difficult part of the UCAT, and how to approach the subsets of the UCAT individually. So UCAT stands for University Clinical Aptitude Test. It is an admission test for both medical and dental degree programs. The test is exactly the same. The reason we need to know this is sometimes in some scenarios, when you are a medical school applicant, the question may say like you are a dentist and you are coming across a patient, etc. Maybe for the question, you just have to think as if you are a medical student. It's a computer-based exam. I don't think anybody is old enough to take any like a part one driving test or something like a life in UK test, but it is a test which you will be coming across many, many, many times in your life. And once you join your medical school, you will be having these same computer-based exam again and again in undergraduates and postgraduates. So you will be quite used to this. In fact, you will know how to write in a paper in future. And worldwide, not only UK, other universities also use this as a part of a selection process. For example, in countries like Australia, UCAT is given lots of importance and people study in UCAT for one full year. And the UCAT is scored out of 3,600. If you score something like 2,900, 2,950 in UCAT in Australia, that's a very, very poor score because the average score is 3,000 and a good score is something like 3,400. While in UK, even if you touch 3,000, you'll be getting very good schools. The UCAT scores are handled by universities in a different way. Especially one of the subset known as situational judgment is slightly controversy with different universities. Some don't accept that UCAT method of assessing the situational judgment because they feel they can test it during the interview process. That's why the situation judgment will not be a part of the total score, the 3,600. And situational judgment is separately branded and banded. And you will be also asked almost similar questions in the interviews. That's why, as Dr. Ryan mentioned, it's important for you to have a proper work experience to get the real-time feel of what is the situation happening in hospital, coming across a difficult patient, coming across a difficult colleague, coming across a challenging situation, etc. Next slide, please. So there are 5 domains. We also call it as subsets. Quantitative reasoning. It's to do with a lot of calculations and you need to use your calculator. They will be giving you a simple calculator, which is present attached to the system, not your own calculator. Decision making, where there will be a situation where you need to make a decision on the solution. Verbal reasoning, for those who have passed through the 11 plus, this is nothing but the same verbal reasoning, but with bit of a steroids, I will say. Abstract reasoning, for lots of candidates, abstract reasoning is the most difficult one. But having said that, you need to check it like a puzzle. You need to think what actually that UCAT question setter have in his mind when they are setting up the questions. The persons who write the UCAT questions are known as subject matter experts, SME. So if we think from their shoes, all the things will be quite easy. Once we teach the students, the main reason why some students struggle in the abstract reasoning is they think too much. They think always in a very complex manner. They always think there is something big happening and I don't think I will solve this. But there is a very simple methodology where We can start simply by numbers, shape, size, etc. There is a simple methodology. If you follow that, most probably abstract reasoning, you'll be scoring the full marks. And then, as I already alluded, situational judgment, which very more important that you should think as a subject matter expert. If you think like a good citizen, if you think like your own, if you think with some kind of intuition, the marks will be quite terribly poor. Because at any time, you need to think what actually the UCAT wants. End of the day, you want to get the best out of UCAT, and you don't want to show your knowledge in the situational judgment part of it, because you need to think exactly what they want. There is always a question about why this UCAT. It's nothing to do with the A levels. Our students or the children are already studying a lot with this medicine preparation, like preparing for the A levels. Already they had good amount of GCSE, biology, chemistry, physics, maths, and somebody may be doing language, etc. The UCAT is quite unique. But having said that, every subset has its own implication in making you or finding you whether you are a good doctor or not. Say, for example, verbal reasoning, there will be big paragraphs, really big paragraphs. I can't even fit the paragraph into one computer screen. And you'll be asked to read the whole 4 paragraphs and quickly answer all the questions. I'm going to show you in the next slide the number of questions and the time taken. If I give a good UCAT paper with a student and ask them to do it over the next 5 hours or 6 hours, they all will be scoring 3,000, if not 3,200. So the problem comes how to perform in that 2 hours itself. So that's where the Way2Med School comes into place to teach you the exact methodology, how to approach, how to answer the questions in a methodical manner, so you don't have to think anything twice. If you think part one, a step one, if it's working, that's good. If it's not working, step two. If it's not working, step three. You will never come back to the step one. That will save you lots of time. We also give you lot of solutions of how not to answer a question. You don't have to read all the questions and answer. If you try that, then the time will elapse and you will be unfortunately leaving the last maybe 10 questions or 20 questions without even reading. There is a good possibility the last 10 questions may be the easiest one. UCAT purposefully prepares the questions to see whether that particular student is good in identifying the difficult questions and omits it without reading, but guessing the answers. Because there is no negative marks, you should guess the answers and you should flag the answers so that you will have time to come back to it. I have seen my own students got full marks in a particular subset, and they have the first run of the questions by guessing and flagging without even reading the question. And in the second run, they have good amount of time to dedicate for the questions and they are able to answer correctly. And they themselves didn't believe that they will be getting full marks in the particular subset. But when they get the marks, they find the particular subset, they got full marks. And they told me, Dr. Ananda, at least 5 questions I didn't even read, I just guessed it. And even in the second run, I think 1 or 2 questions I was not sure, but they got the full marks. There is, of course, a bit of a luck in it, but the most important thing is the methodology. If they approached the question very sincerely, every question, they will be definitely leaving last 5 to 10 questions without even reading them. That is not a very good approach to that. And then the results will be available immediately after the exam, just like your driving test. And I hope that result will be good for everyone taking part in this program. Next slide, please. Then preparation consists of 5 stages. The first one is learn the concepts. I've just let out most of the concepts already. So like that, you should know what is the concept, how to build the CAT, all the 5 subsets thoroughly, what is required, etc. And then practice, practice, practice. Lots of mocks. You'll be doing at least 20 to 25 mocks, and sometimes you may be doing the same mocks again and again. There is different methods to do the mocks. You can do full mock, you can do subset mocks, and we will guide that. Timed mocks are very important. As I said, there is no point in doing the mock without proper timing. Because end of the day, as I said, if I give you the question without any time limit, everybody will get 3,000, 3,100. The problem comes in thinking in a good time frame and ace the difficult parts. I've got my own experience with some students brilliant in the, say, abstract reasoning, but struggling with situational judgment. And it's easy to find the lacunae. And when I give them the exact technique for situational judgment, put the cap of a subject matter expert. Think as if you are the question setter. And then once you think in that particular way, they can get almost all the questions correctly. But the problem is, it's very easy to slip to their own soul, I will say. So that's why in the mock, in one mock, they will get situation judgment band one, and then they will repeat it again in the next band one, and suddenly they will become band three and they will get panic. And then when I revise the questions with them, what happened? Why you are not thinking with a cap of a subject matter expert? Why you are thinking as if you are like your own? It's not like your own thinking is wrong, but UCAT has a specific way to test you. And if you're going for a tennis match, you need to take a tennis racket. You can't play it with a badminton racket, isn't it? And then on the exam day, that is the crucial stage 5, we give all the instructions of how to reach to the exam stage, what you need to do during the exam, because there is a 1 minute, precious 1 full minute between every subset where you can't see any questions. So what to do in that minute, I tailor the instructions based upon the individual student. I got some students who are quite tensed up, so I will tell them just close your eyes and think that you have done everything well and what's going to happen is well. I got some students who are quite chilled out. So I will tell them to think about 5 instructions, which I'm going to give you for particular subset. So they can think, okay, next subset is abstract reasoning. I need to think about size, shape, distribution. So there is a specific formula to that, which we can help them so they can think about that. So we need to tailor everything to the individual student. The total time needed for the full UCAT preparation is all individual. We are going to start the UCAT service as early as, say, July, as mentioned by Ryan in the Way2MedSchool, the diagram. If you're starting a bit early, you can have a very nice scenic route and enjoy yourself. You can have a good break. You can have a good holiday to your home country, and still you will get the best mark out of the UCAT. But if you're joining too late, I am handicapped. You are giving me very less time to prepare you into a correct shape. We will do our best, and it will be a very jam-packed program. Choice is yours because we always have students happening. Even if there is one student, we are going to continue the full program starting from July. So get the best out of us so that you will get best out of yourself.